Hello, good morning, class. Good morning, professor. My name is Ibrahim Diallo. It's really a pleasure for me to be in this class FNP 595. Um, I'm looking forward to completing this class with success. My current location is truly between New York and New Jersey, and the reason for that is my parents, have a house in New York, but I live in New Jersey, so but very close to each other. So I'm always navigating between New York and New Jersey. But my precise current location would be still New Jersey. My clinical experience with chronic conditions is actually extensive since my graduation 5 years ago from nursing school. I've worked with various patients with chronic conditions such as diabetes, hypertension, COPD, arthritis, osteoarthritis, chronic migraine headaches, you name it, depression, anxiety, insomnia, you name it, right? Basically, chronic illnesses, once you get diagnosed with a condition, and that condition lasts more than 6 months, that's considered to be, more often chronic conditions. Although some conditions may be considered to be chronic after a couple of weeks or so, depending on the diagnosis. But I experience working with chronic illnesses not only in the nursing home, but also in the school setting, in the clinic where I'm doing my clinical rotation currently. And what I notice in general is, once the chronic condition is well managed, the patients are able to maintain their health, go alone, routinely do what they have to do. But if, they experience a change of status, like that same chronic condition, worsen somehow because of either the patient is not complying to the medication, or maybe they are like a new onset of other condition or comorbidity that kind of worsen the chronic condition that was already in existence, or any other reason that causes that normal chronic condition to become worse, then those patients have to be stabilized either in the clinical setting, or they go to the hospital, and then once they are stabilized, and then they return back to that chronic status, either they go back to the nursing home, or they go back to their house, go about their routine, and if there's any medical issue, then they go see the doctor or nurse practitioner in the clinical setting. This is a very interesting environment, honestly, because you'll see new condition that turn into a chronic condition, and then you'll see a chronic condition that exacerbate and become an acute situation, and then revert back into chronic condition. So this rotation is constant. That's why you're gonna see patient admission, readmission, admission, readmission. This is a constant cycle. But the good thing is, you'll see um, many version of possibility of improving the patient's chronic condition, or it give you opportunity to determine why the condition exacerbated from just that level of maintenance to a worsening situation. But in any case, it become really a good learning experience. Last, my ideal practice setting after graduation will be still in the school setting, the nursing home setting, and the clinic setting. And the reason for that is because these practice setting are actually kind of connected deeply to the community, and and often these settings like are really very poor, underserved community, who from people who really don't have much access or a lot of choices as far as like healthcare. But I like to come back to these people with more education and more skills, so I can provide them a better care. So thank you for listening to my presentation, and I'm more than happy to be in FNP 595, and I wish you all best luck, and I'm looking forward to passing this class with success. Thank you.